Hi, I'm Steve Cherry.
And I'm Jason Lipinski.
We're here today to introduce you to our new SynDaver mannequins.
This SynDaver was given to us recently. This is a new piece of equipment, a very delicate piece of equipment. The old mannequins we used to have, plastic in nature, they were pretty antiquated compared to this equipment. And as Steve is showing you, this is our adult mannequin for intubation, very realistic. These skins actually represent more like a human skin. They're made out of fibers, water, and sodium, kind of like our skin is made out of. We also have a adolescent, and then we have our infant. So we can be doing intubations on all these different mannequins. Another thing about this product is the teeth are very fragile. They represent human teeth. So when we're doing our actual intubations on these, make sure that we're using the proper techniques. This equipment is going to be used under supervision. We'll be doing this at the training center under our supervision. If you guys have any questions on how to sign up for it, we can go over that process on how to get a date up here so you guys can use this equipment. Intubations will be used on these mannequins, and then we can do our surgical crike and needle crike on this mannequin. The skins on these are removable, so if you want to remove the skins and show, we can be doing multiple sticks. Unlike in the previous, we had a skin that kind of overlaid. This stuff, we can do about 1,200 of these skins overlaid onto this mannequin. This company also does muscular tissue, so all these different tissues have a certain amount of newtons that cut into these tissues at certain weights. So it'll feel very realistic when you're using a scalpel and or needle on these different skins. Also on the inside, we have our trach in there, so we can have the cricoid membrane broken just like you would in a normal crike. So when we do this, we can change them out on every one of these so you guys get a realistic feel for this stuff. Now that being said, this equipment is very sensitive. We have to take a lot of care with it. So we have a fish tank over here, an 80-gallon tank where we keep all this equipment, and there's a cleaning process involved with all this. The cleaning process is we use an algicide, an opticide. We use some little packets that have a chlorine bleach in it, and we basically monitor stuff every 2 weeks. If you guys have any questions on this product, we can kind of show you all the information and show what we can do with it. You want to demonstrate, or should I demonstrate the intubation on this?
Go ahead, I'll hold.
Fantastic.
I'll hold for you.
Thank you, sir.
Out of the way, hopefully.
So on the adult patient, we're gonna be doing intubations like we would in the field. Check our equipment, go in here. Like I said, the teeth are very fragile on this piece of equipment, so make sure when we go in here, we're being very careful with this stuff. Okay? And as we go in, you're going to visualize the vocal cords. It's very realistic. Okay. And can you see it?
Yeah.
Perfect. Good. So this is going to be a lot better than what we did before as far as our training for intubations, crikes, and we'll be continuing use of this.